Welcome, everybody. We are back with another installment of our So You Want to Be career series. I'm Kayla Matthews, owner and CEO of What the Doula. I'm representing STS today, and our topic is So You Want to Be in Healthcare. We have a series of, or a couple of amazing professionals on the line with us. One of them is actively in practice. You'll learn that healthcare doesn't stop just because we want to do other things. And so he'll join us at some point. You'll see him come on camera. But I want to start off by allowing all of our guests that are present to introduce themselves. And we'll just start with that first personal introductory question. So, beyond your title, I want to like throw that in with you telling us. So, tell us about who you are, where you're from, and how you got started in this work. But then, beyond your title, what's something personal about you that a lot of people wouldn't know? And whoever wants to start can jump in.
Okay, I'll start. My name is Walesha. I'm a pharmacist here in Memphis, Tennessee. Did my undergraduate um, degree at Ole Miss, University of Mississippi in Oxford, Mississippi. Came back home to Memphis to go to UT for pharmacy school and to get my MBA from the University of Memphis. Um, how I got into this industry was honestly non-traditional. I know some people go to college and like know exactly what they want to do, but that was not me. My first year of school, I was undecided and I decided to take chemistry the next semester, chemistry and biology. I was like, I'm gonna see if I want to do healthcare. And I turned out to be really good at chemistry. So I was like, I'm gonna check this pharmacy thing out. And it worked well for me. So yeah, it's okay to not know what you want to do your first year of college because that was definitely me. And just something personal about me, I am also a photographer. I love taking pictures when I am off work. Got in late last night because right after work, I went to do a prom send off. I had to take some pictures for somebody going to prom. So that's something personal about me.
Okay, so my name is Iman Grace, and I am from the small town of Brownsville, Tennessee. So I'm not a Memphis native, but I'm close enough because whenever I introduce Brownsville, no one ever knows where it is, and so I just say I'm an hour outside of Memphis. So that's kind of a personal thing that nobody knows about me. But I'm from Brownsville. I went to Austin P for my undergrad, and similar to Dr. Yates, I knew that I wanted to be. I knew I wanted to be in healthcare. I didn't know what I wanted to do, so I changed my major actually a couple of times during undergrad before I solidified on my degree of healthcare management. And then I went on, I got to Memphis through my master's program. I came to the University of Memphis to get my master's in healthcare administration. And through various roles, just ended up staying here. And so something that people wouldn't necessarily know about me is that I am deeply introverted. It takes enormous amounts of energy for me to like get out and network and do things like that. So I am I'm a homebody. I love being at home. I love being in like my secure spaces. So yeah, that's something that in healthcare can have its challenges because I am deeply introverted, and that is healthcare is a field in which you got to interact with people. So um, I've learned over the years how to manage my energy and connect with others, but still, come home to myself when I need to.
I love that. I too, y'all did not have a desire to be in healthcare. I actually promised my AP biology teacher, Angel Perkins, if she passed me, that I would never, ever take up a career in the sciences. And now I'm a whole midwife. It's beautiful how what you're called to do catches you. And so, thinking about y'all's biggest influence on your decision specifically to pursue your path, who was it or what was it? Iman, can you start us off with that?
Sure. So I come from a family, I will say a family of healthcare providers, but a family of service providers in like as a broad overview. My granddad is a farmer, so of course he like provides food for folks. And my mom has worked in healthcare in various roles, and she's currently now an administrator. So we actually share the same job description at this point. But and my uncle is a physician, so I knew that I wanted to be in the healthcare space. I feel like that's kind of a calling that my family has kind of had on their lives and is kind of transferred to me. But I didn't know what realm I wanted to go in. So I'll say that my family overall kind of influenced my decision to go into the healthcare space just because of the things that I've seen in the past.
Dr. Yates.
For me, nobody in my family's in healthcare, so I'm like got the opposite experience of Iman. But I it was this lady named Miss Kelly. I love Miss Kelly, and she was a pharmacist, and I thought pharmacists only were in the Walgreens, Kroger space, outpatient pharmacy. But as I got to know her, I learned that pharmacists are in the hospital, like I am now. They're out there in the industry, drug reps, going to hospitals and other outpatient practices, getting people to acclimated to new drugs that are coming out on the scene. So that really interested me. And so I said, okay, I'm gonna check out this healthcare space. So I started going to different pharmacies, asking the pharmacist there, can you tell me what you do? Like every day, what is a day like in your world? Like, so I went to an outpatient pharmacy named Cheney's, and I was at Ole Miss, and I asked for a job. I was like, hey, I got about 4 hours after classes. Can I just come work? And he told me, well, we don't need any pharmacy techs or anything. You don't have your license, but you can be our what do you call the people that check the people out when they get their
Clerk,
medications?
a cashier.
A cashier, a clerk. So I was like, okay, I can do that. But while I was checking people out afterwards, I was like, hey, so what you doing right now? Like, what is that? Like, what are you like? Are you checking your medication? Like, what are you doing? So just asking questions and being okay to do something for a few months, even if you hate it, seeing it through so you can know, okay, this is not what I want to do. Or hey, I like this part of this, but I don't like this part. So just being inquisitive and being willing to try things out even when you don't already have the answers to everything.
No, I think that that type of grit is something that these new like I'll say like these last two generations are being preached over and over again, and I think our generation is like gracefully doing it. Like we are, I know a lot of people in our generation that are, just like finding something, working at it, and then being like, all right, on to the next thing, and let me ideate this next, and or have their hands in multiple buckets, but well. And so I love that that was in both of y'all stories. I also want to take a point of personal privilege. I see we have Dr. Jones on camera, so I want to allow him to introduce himself. Thank you, Julian, for joining us. We are only on the second question, so I want to swing it back to the first one for you. Tell us a little bit about who you are, where you're from, how you got into this work, and then what's something beyond your title that people don't know about you.
Hey, how y'all doing? I'm Dr. Julian Jones. I'm a dentist here in Tulsa, Oklahoma. I'm originally from Memphis, born and raised. Um, Graduated from Meharry Medical College, class of 2024. Um, and honestly, I got into dentistry because honestly through athletics. My dentist is Dr. Steve Ballard. He's still a practicing dentist in Memphis now. He's been my dentist since I was a little boy, back when he had an office over there off of Elvis Presley. And honestly, I got into it because he helped me get over my fear of needles. Like I remember having a real bad toothache one time, and I was just just like any other kid, you're in there, you crying, you feel like you're scared because it's the dentist, you hear drills, needles, things like that. And he just really just walked me through it one day. He was like, man, I know you're hurting, but I tell you this, you're gonna feel a small pinch, and then all that pain you feeling will just go away. And then after your face starts feeling good again, the pain you feeling will be gone all the way. And I just trusted him. And then, like, sure enough, I was trying my best not to cry as he gave me the shot, and I got it. And then my face went numb. He did what he did, and ever since then, I was just hooked. I spend a lot of my time in his office just watching him. That was the first time I seen somebody that looked like me in that position. So I would definitely say like representation played a big part in me, pursuing dentistry. And beyond the title, it's crazy because I always say this. Like when I step out the office, I'm like, yes, I'm a doctor when I'm in the office, but when I step out of the office, I'm a regular guy. But sports, yeah. Like I said, I was an athlete, and that's another portion of our relationship with Dr. Ballard was that he, like I said, used to play for the University of Memphis. He used to play basketball, and he helped me through the recruiting process as far as me playing football, and I got recruited to go play at Arkansas State, and then later on went and played in the NFL and the CFL. So he was like a big mentor of mine as far as guiding me through that. And I would say like just beyond that, I'm a kind of a laid back type of guy. Like I love sports. I love like working with my hands. Like I can't work as much with my hands now because I use them to for what I do now. But I used to like just like putting things together, like working on cars. Put just as long as I can use my hands, I'm kind of a kinesthetic learner. So that's a little bit about me.
Thank you. Y'all are also different and interesting. And what I love about getting the different types of professionals on this call is it gives the students a real live view of where they really could be in the different ways that they really could get to these spaces or places. Jeremy and I were just at Lamont on the other day, and I was talking about transferable skills. I'm on my fifth career, in my 30s, and they've all been drastically different, like going from the classroom to sewing people's body parts. Um, like
Dramatically.
very, very, very drastically different. Like I'm
Yeah.
mixing meds. What?
Yeah.
But I owe that honestly to the preparation that I got in the classroom. Little did I know it in the various classrooms that I've been in. And what I love about all of your professions is it required a higher level of that classroom and various different classrooms and the things that you'll get in the connections and the networks and the rooms and the clubs and the organizations that you need to be a part of and need to become familiar with to be successful in y'all's roles. And so thinking about your journey specifically, what's one thing that you believed about healthcare before entering the field that turned out to be completely wrong? And we'll start with you, Dr. Yates.
For me, I think I hinted on it earlier that, and I'm just talking about pharmacy period here, but I just believe that there was only one type of pharmacist, outpatient pharmacy. You're at Walgreens, you get prescriptions, you're filling them, and all you did was put the medications in the bottle. But actually, we're the ones who see the drug interactions. We're the ones who see that, hey, if you take this medication with this other one you got, you could die. Something could happen. So just we're the ones who call the doctors and say, hey, I know you put this medication in for this dose, but this patient is on hemodialysis. His kidneys can't handle this dose. So, we are do so much more than just put medications in bottles. We're searching out for drug interactions. We're helping the doctors pick out the correct doses. We're like, hey, like you said, you're treating them for this, but you put this dose in for a sinus infection. You need to get them a higher dose for something like this. So, just that kind of thing, knowing that we actually do so much more than I thought we did. So that would probably be my answer to that one.
And then what about you, Dr. Jones?
I would really have to piggyback off of her. I didn't know that in dentistry it was a lot of comprehensive care. Like I have patients who have high blood pressure, diabetes, or dialysis, and depending on like what they do, it's like I can't necessarily treat somebody the same day that they have dialysis, typically the day after, or patient might have might about to start chemo or something like that. So they need to come check in with me to see if they have any necessary dental work that needs to be done before, I can clear them as far as like, hey, this patient is cleared to go ahead and start chemo or radiology and stuff like that. Because, you hear dentists and you think I'm just working with the teeth because, I'm essentially a head and neck doctor. So like, uh, I do oral surgery, I do things like that. I've actually had a patient where I had to kind of sew their face back together from kind of like falling off and stuff like that. But I didn't realize how much that you actually work with other specialties, and like Dr. Yates was saying, just me consulting with the pharmacist about what to give my patient if they have some type of allergy to this or some type of allergy to that, and just being open to like collaboratively treating this patient.
I think we lost Kayla, so I'm gonna go ahead and
Thank
answer
you.
the
My
question.
grandma called. Sorry, I'm a
No, you're
caretaker. Jump in,
you're
Iman.
good. I think that the one thing that I believe about healthcare, that turned out to be, I'm not gonna say completely wrong, but I just had a different viewpoint, is that you have to be clinical in order to be of service in the healthcare field. But the more that I've worked, and because I'm an administrator, right? So we're usually the villains and everybody in the healthcare story. Even in TV shows that you see, no one likes administration. Nobody likes the business side of healthcare. But in the landscape in which we live, the business part is a part of healthcare, whether you want it to be or not. I think a lot of the clinicians, um, doctors, nurses, pharmacists, they're all learning that you need some type of business acumen or understanding in order to function in the healthcare and make your work profitable, right? Like, and not even profitable, but be able to do the work. For good or for bad, you have to have the money to do it. So I think um you having the knowledge of like, okay, this is a business, but we also are in the business of helping people, curing people, and making sure that they are at the best health that they can be at is what we want to do. But we have to have the a strong business behind it to make it run. I think that is something that I come to the realization of now, is that yes, the clinicians are the bread and butter. They are the most important part of healthcare because they are the ones that serve our patients. But you don't have to be a clinician to make an impact in healthcare, because it is a business, and those clinicians need the business to run correctly in order to do what they do well. So,
I love that. Yeah, I think one of the things that's been really cool for me to discover on this side of stuff is like all the small things that you think don't matter matter. I'm one of those people that like I would grind my gears when I would get those long intake forms or it's asking me this silly question that I don't think I need to answer. And I'm like, now that I'm on this side of things, like that actually might impact the thing that you can take or can't take, or, what question set I may go into or not, or what screeners you may or may not get. And they need that data. And so that be like taking my math brain and connecting that now with my healthcare brain. I'm like, Kelly, you just been defying all these years for no reason. Folk probably could have helped you a lot faster. So it's always interesting how we can be proven wrong. Okay. Thinking about the defining moment in your journey as a healthcare provider, your career in healthcare, what moment confirmed for you like, okay, I'm doing what I'm supposed to be doing? Or has there been a moment that confirmed for you, like I'm doing what I'm supposed to be doing? Are you possibly thinking about a pivot? Let's start with Iman.
um, I don't know that there was a specific defining moment for me. I just knew that I wanted to be in healthcare, but I was flexible on what that looked like, because I honestly started college with the clinical mindset. I was going to be, I think I started off undergrad thinking I was going to be a dentist. So I started off with dentistry, and then I realized that I don't want to work in people's mouths all day. And so I changed it. So I went to nursing, but then I wasn't good. I'm not gonna say I wasn't good. I didn't. The science classes were not. I didn't have the grades to get into the nursing program at my school. So I was like, I'm going to be here forever. This can't be. And so I think that the defining moment for me is when I did choose the path that I chose. The doors kept opening. I stopped hitting walls as much when it came to my decisions not taking me where I wanted to go. The doors kept opening. So I was like, well, this seems like the path that I need to be on because this this has worked for me. So I think it's more of a series of, okay, this has gone well for me. Let me continue to walk down this path and see where it goes, and it's led me to where I am now. So I am currently not considering a pivot, but I will say that I'm always open for opportunities where, similar to this, if a door opens and it in my background supports me taking that next step, I'm always gonna evaluate it and see if it's a possibility for me. But right now I'm not looking to pivot, but maybe enter a different space within the healthcare administration world or the business side of healthcare. But I'm right now I'm planning to stay where I am.
I have to piggyback off Iman when she said when the doors started opening, because that was me. Because I was like, Lord, you're gonna have to show me, because I'm not about to waste any time at this undergrad school. I got to get up out of here in 4 years. We're gonna have to decide what's going on. So when I finally decided to test out, how I was in the sciences, taking biology and chemistry, micro, all those classes, like doors just kept opening for me. Like I got that job at Cheney's I was telling y'all about, learning about the pharmacy industry. My chemistry teacher asked me to be his teacher's assistant. And then I had another door open where God was just opening the doors for me, allow me to get really close to my science professors. Like I barely had to ask for letters of recommendation. Like I just knew they were going to say yes because we had built such a great relationship. So it was just the relationships, the doors that just kept opening. Like I wasn't hitting any walls. Like Iman said, not saying y'all won't reach, hardship in your journey, because you will. Nothing worth having is easy to have. So that's not what she was saying, or not what I'm saying, but um it's going to always work out in your favor. And it's always going to God's always going to show you the next step. He's not going to show you the full staircase, but he'll show you, okay, this is what you need to be doing right now, this is where you're going next. And every time it's time for another door to open, you'll see the next step. So that was my kind of defining moment, just seeing how God was just continuing to open the doors for me. And opening, like, as on this journey, it's been like, okay, I think I'm on the right track.
For me, this was my pivot because, like I said, I was a former athlete, and it was a struggle for me to kind of like go from being like this athlete to having to fix my mind. Like I gotta go climb this mountain to get into dentistry and become a doctor. But I would say because I'm just kind of like you, Kayla. I worked so many jobs. Like I was a teacher in Memphis for like 5 years before I even got into dental school. Before that, I was working at LA Fitness. I was a bouncer. I was just doing a lot of jobs to work as a means to an end. Like I knew it wasn't going to be a final career for me. It was just what I needed in order to learn the lessons I needed in order to get to where I'm at now. See what I'm saying? So as far as pivoting from dentistry, only pivot I may consider is maybe a specialty, but honestly, I love what I do. Like I would say, going through like I said, overcoming the adversity of like um, shaking the funk of like, man, like I've been an athlete my whole life. I don't really, I'm kind of what 5, 6 years older than everybody else who's in the school, and it was like, man, you for me, it kind of like confirmed because what confirmed it for me was like I was in dental school and I had a lady who came in and didn't like her smile, and essentially, make a long story short, we ended up like pulling all of her teeth because they were just in bad shape, and then we gave her a denture. And how that lady like responded when I gave her that denture and she smiled and saw herself smile for the first time, according to her, for like years, and we were literally in my operatory just like she was crying to me, and it felt like it's almost like you sit there, you bump your head, and then you finally see the end of the road, and like, you know what? This is what it's all about. You changing lives, you put a smile on somebody's face, and you boosted their confidence, and it was like, you know what? God, I get it. this is why I went through all that in order to get here. And they just, if, from that moment on, it just clicked for me. Like, hey, this is where you're supposed to be.
That's a beautiful like way to end that question. Thank you for that. All right, y'all. A couple more questions like in this category, and then I want to pivot because I'm watching our time too. Thinking about the habits or strategies that have helped you succeed at either academically or professionally. Uh, Whoever wants to start with this one, could y'all share what some of those habits or strategies are?
Kayla, can you clarify that question? Like when you say habits or strategies, do you mean like how we particularly got to where we are, or just like what we do on a day-to-day basis?
So thinking about either what made you succeed academically to get here, or in your field, like as however you're operating, like what habits or strategies do you have to employ? Like I know specifically for my field, it's a lot of calendaring. Like I have to be very, very good at time management, but then also I have to be good at storytelling because I'm charting a lot, and it needs to tell a story without telling too much of a story and hold up in court.
Okay, I'll start it off. I would say one of the skills that you have to be able to deal with is to be kind of step out of your comfort zone and be more of a people person, because in my field I see politicians, I see policemen, I see firemen, I see teachers, I see regular people who work at Walmart, I see mechanics. So you kind of got to be personable with a various amount of people so they can feel comfortable with you. And a lot of that really comes in because the first thing somebody tells you that, man, I hate the dentist, or I haven't been to the dentist in such and such long, and then you come up with a dad joke, some kind of an icebreaker, like they say I hate the dentist, like, man, I just met you, like how we hate each other, something like that. But I would definitely say like being more of a people person and learning to listen a lot more than you speak, because somebody coming to you and you're essentially problem solving. We're all of us in healthcare. That's pretty much what you're doing is problem solving. So you kind of have to do that. And like you said earlier about being on a schedule, like being very organized, because like we start our mornings with a morning huddle, and we go through like the whole schedule. Like, hey, this is what we're doing, and to the detail. We're like, okay, this person may want nitrous, they may be a little anxious, or this person here is a little bit more tolerable of the procedure. Or this person here is definitely afraid of whatever. So we, have to come up with different techniques, and just being having an open mind to try different things in order to get the main goal accomplished.
For me, I probably say learning how you study. Like for me, I know that I had to rewrite things. I had to record myself saying things and go back and listen to it. And it took so much time. And you got them people who just can go to class. Remember, so my best friend when I was in school, she could just sit in class, hear the lesson. That was it, barely study and make an A on the exam. That was not me. I really had to work hard. I really had to rewrite my notes, really had to re-listen to them, really had to go to office hours and get my teacher give me example questions of what may be on that exam because I just can't do it. So we reached the same outcome, but I had to work a lot harder than she did, and that's okay. But it just taught me how I learn best. I think learning how you learn best is the key to your success. And you can't, I had people who were just in different majors. I mean, we would go to the library together and they would leave at like 9 o'clock because they done. They can study for 2 hours and be done. I couldn't do that. I had I had to be there till about 2 o'clock in the morning because I got 3 tests tomorrow. So I don't know how y'all doing it over there, but so yeah, just learning how you study, what it takes for you to succeed, what it takes for you to reach those results that you're trying to reach, and also putting your pride aside and being open to learning from other people. And that's something that you need to learn even in your career now. Like I have pharmacists who've been pharmacists for 20 years, and I've been here I graduated in 22, so I've been a pharmacist for 4 years. It's some stuff that just only experience can teach. And so being open to listening to other people and saying, hey, I know you've probably seen this before. I haven't had this kind of patient. How should I treat this patient? How should I adjust their medications? Being willing to open and listen to other people.
And I honestly have a similar answer to both Dr. Yates and Dr. Jones. Um, because circling back to me saying I'm an introvert, it was really difficult for me to network. But honestly, that's the way that you build your success in this field. Whether you have a clinical background or you don't, you still have to, like me as an admin, even more so, I do need to go and talk to my providers. I need to talk to the nurses. I need to talk to the doctors. I need to talk to all of the staff because they're the ones that are doing the work. And of course, the work informs the decisions that you make from a business aspect. So, me being able to talk to people was key to knowing how to do my job well. And so that's a skill I had to hone from college. And it's still something that I'm working on now because I'm in a different place in life, and so I kind of have to re-engage those things. But that is something that's really important. Is just being able to talk to people and being a lifelong learner and being willing to accept critiques as well as education from people that you may not want to accept it from. Like everybody doesn't deliver their 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 education well. Everybody's not nice, and so you have to be open to getting feedback in a way that is not always the way that you receive the feedback, and still be able to take what you need and leave what you don't, and use it to make a better, like, do your job better. So I think those are the things that I have developed, but I am actively still working on in the field. So hopefully make a change or a difference.
Adding to something that y'all said, I think, and this brings me back to my days as a teacher, a habit or a skill that I will always encourage my students to practice and to get comfortable sitting in, especially as you go in rooms that you've never been in or rooms you desire to stay in, is being curious about how people got there, who they know, what they do outside of being there, how they reset and recalibrate themselves, why something isn't working out for you, why something was so easy, like just, like not just settling and just being able to be there. But, when somebody asks, are there any follow up questions, come and prepare with a couple of them. Being able to extend the relationship with somebody goes super far. Or getting somebody to talk about themselves, it goes so far, so much further than and then extending what Dr. Yates said, and then knowing how you learn and your learning style. I used to love activating my scholars' learning styles and showing them how they, like, our lesson would not have been as impactful if you didn't perceive it that way. And it's the same with our world, right? If everybody learned the same and everybody processed the same, we would live in a very like gray world. But it's because people are coloring outside of the lines that our world and our technology and all these things are ever evolving. And so, really catalyzing students, professionals to do that. I love that you said that on this recording. Okay, pivoting into some of the fun stuff, because I like to like have the end kind of be about some of the non-worky things, but still work things. If you could redesign your pathway here, like to where you are in healthcare, and specifically thinking about your college experience to better prepare you for this role that you're in, would you redesign it? Is there anything you would change? Like, how do you think it could have been better? Anybody can start.
For me, I would probably say I wouldn't change anything. I feel like everything worked out the way it was supposed to work out. Um, God gave me those relationships I needed, those relationships with like professors, gave me the experience I needed. And just like I said earlier, being willing to try different things. I've been in the outpatient space, I've been in the inpatient space, I work in the hospital now. But I know that I like the hospital because I know that I hated the other stuff that I tried out before I got here. So being willing to try different things out. I don't regret hating working in some of the spaces that I worked, but now that I know that I just know for sure I can't go back there. I can't go back to that space. So I think it all worked out the way it was supposed to, and I'm right where I need to be and where I want to be and where I'm happy working. I go to work and I enjoy being there. It's not like, ugh. When I used to work at those other places, I'm like, ooh, I can't wait to get home. It's just now 9 o'clock. I just got here at 8:30. So, but just being at a place now, I'm like, I really love where I work. I love what I do, and so just being inquisitive, being willing to learn, being willing to try different things out, and I'm glad I did that. To someone else, it may look like wasted time, but to me, it was carving out my path, knowing where I belong in this space.
For me, I'm gonna take the same path as Dr. Yates. I don't think that I would redesign my college experience for either undergrad or for my master's. I think that I needed to experience all that I experienced to be where I am today. I would say that for the experience in general, just whatever it takes to be an administrator, as far as the college path is concerned, I would say that I would like there to be more opportunities for hands-on experience or in-office experience, at least for the people that are in my world, because you do come at things from a business mindset. And if you don't have any healthcare knowledge or any clinical knowledge, I feel like you need to be immersed in the clinic setting or wherever you are to understand how how the clinicians are doing what they're doing and why they're doing what they're doing to have the best outcome, because you are kind of an outsider in the space. So just in general, I would say that as a college student, try to get as immersed in your field as you can. And that goes for clinical students too, but especially for if you're like in a business role or a setting, get immersed in what you're doing to understand why the people that are providing the care are doing what they're doing, because that will make their job and your job a lot simpler on the back end.
I agree with that 100%. When she was talking about like not there not being enough opportunities for like internships and seeing what people do and why they do it, but I would tell people this generation, because that is so true in mine. But I would tell people like, hey, annoy these people. Hey, can I just come watch you? Even being willing to do it without pay. Like I'm not looking for you to pay me. Can I just come with you for 8 hours today? I just want to see how your day is, what you do. And
I just want to
sometimes you
come
just have to
sit
do
and just watch you.
you just have to put your foot out there, and when they say, "No, I'm busy today," wait a week and go back again and ask again, because that's what I did.
The only thing that I would change, like I said, I'm grateful for how my path um, rolled out for how I got here. The only thing I would change, I would say, I would get involved in research earlier because, especially in our fields, it's just like in medicine in general, it's always changing. Like, I mean, Dr. H probably would hit on this. Medicine changes like every 2, 3, 4 years. Like every day, like you get a list of new medications to come out. I would just get involved in research a lot better because it allows you to kind of have a more informed and an in-depth understanding about what it is that you do. Because we'll have different products. Like implants alone has changed over the past 10, 15 years. It's like a night and day difference now. Um, Also, I would definitely encourage, like I was saying, to ask a lot more questions. Like you said, not that you want to annoy these people, but you kind of do want to annoy them with questions because it kind of shows that you have a vested interest in what it is that you're doing. And my policy has always been, make them folks tell you no. You know what I'm saying? Like if you go in there and you just ambitious, because somebody will give you yes. Like you just keep asking, and once you get rid of that, when we're young, you kind of have that fear of rejection. You don't want nobody to tell you no, or you're scared to ask because you might hear no. It's just, man, listen, let them folks tell you no, because I guarantee you, you asking questions and you coming from a genuine place, somebody will let you come in and come take you under that wing because I could I can hopefully I can speak for everybody up here, but somebody had to do it for us. So somebody's gonna do it for you. You see what I'm saying? Like I literally just told you I had Dr. Bella let me come into his office, and I had a ton of shadowing hours, and like he would just take me on his wing, and I would ask a lot of questions, even from like something as small as like how do you pick a front desk or why do you do this, why do you do that, If anything, it kind of helps you build a skeleton to where you can kind of put the meat of the information that you're learning together, so it kind of makes sense later on down the line.
One thing I wanted to extend that y'all talked about, it was funny, it got brought up, Jeremy and I was talking about this off camera, but how we're noticing that this generation of learners kind of backs down from discomfort or a hard thing or disagreement or
Yeah,
whatever.
avoiding.
It's like, oh, you didn't like how I said that, so this relationship, this opportunity must be over. And it's like, no, I didn't like how you said that, and you're gonna work on saying that differently, and we're gonna get our job done because we got a job to do.
Exactly.
um so I thought it was funny that y'all brought that up because you will get told no a lot of times, or that you did something wrong, especially as you're growing and climbing through the career or the field that you're in. But when your heart posture, I said this at the other night at LLC, when your heart posture is in a place or space to receive love, you'll receive love instead of receiving offense.
Hmm. I
Even
completely
someone's
agree.
no. Like you're like, no, it's a no, not now, because I'm not ready for it yet. And so I need to do the things I need to do to get ready, but I'm coming back so you can tell me yes. Okay. So thinking about like y'all's real day, because y'all all three do different things in your real day. You're probably really, really busy in your real day. How do you keep from burnout? Because all of y'all seem to like what you do. How do you stay here and not be like, oh, this job?
Go ahead.
Go ahead. Go ahead.
Well, I would say, for one, you got to learn early to leave work at work. And what I mean by that is, when you at work, you need to give work your all. So I'm here from 8 to about 4 or 5 ish. And I give my all to my patients because, and when you're in these positions, not that you're in a higher power, but you're in a position of like a lot of responsibility. And you don't want to like, you want to make sure that you try to fulfill these responsibilities to your best ability. But when you walk out that door, you need to leave work where it's at. Now, whatever you didn't finish, as long as you gave it your best shot, cool. And understand there's going to be highs and lows with whatever you do. Also, find you a few hobbies. Like me, I love working out. I'm always at the gym. I'm a gym rat. And lately, since I've been out here, I picked up golf. And just trying to find something that can kind of get your mind off what you do, because burnout is inevitable. It happens to everybody. Like even when you're in school, like there's been several times, but like I'll be looking at a page, studying something. 3 hours and went by, and I'm looking at the same page and rereading it, and still nothing was clicking. But and it's normal. And honestly, it's just a part of like listening to yourself, knowing yourself, and understanding like, okay, I need to reset. I need to put this down. I need to step away. I need to, maybe watch some TV, or just go for a walk or something like that, to kind of get your mind off it. And then like when you come back, you'll be refreshed and you can look at it with a fresh set of eyes.
I'll piggyback on what Dr. Jones said, leaving work at work, but also taking time for yourself too. Like PTO is there for you. You can use your PTO. I started working and I was just like so scared to take off. I'm like, oh my gosh, if I take off, they're gonna think I don't want to be here. They're gonna think I don't want to work. I got 150 hours of PTO. I have not touched. I went to my boss. I said, "Hey, how much time do you need? I just want about a week to myself. I want to go out of town. So is 2 months enough? Is 3 months enough in advance for me to go ahead and put that in? So just taking time for yourself. Now, I'm not saying, hey, I'm off tomorrow. No, don't do that. Plan it. You want your boss to view you in a great way, but like plan in advance and just take time for you every couple months. Go on a trip. It's okay to take off work and not be there every single day. Go on a trip, and also, like Dr. Jones said, get hobbies. I'm a photographer. I love taking pictures, and it takes my mind off everything. If I had a stressful day at work, I just started piano lessons yesterday, y'all. It was my first day. I'm really excited. So, but just like learning different things. Because I wanted to pick up something else because I'm about to study for this board certification. I want to get an advanced care certificate to learn how to be in a certain space in my job. And so I decided that while I'm studying for this test, I'm also going to take me some piano lessons so I can have a little fun while I'm studying. So just having hobbies, taking time for yourself, that would probably be my advice to avoid burnout. And it's okay to pick up hours, but don't let work become your life. Like you shouldn't be working 60, 70 hours a week. You know what I'm saying? So yeah.
Doc, you hit the nail on the head. Listen, you went through all that schooling to get to this point. Like, take some time for yourself because you might be the doctor in the situation, but if you don't, it, if you let that consume your life, it's a bad deal. So the whole point of you getting these profession is to help people, but also there are perks to the profession that you can enjoy yourself. Like that we're talking about that PTO. Take some time, even if you just need a day. Like mental health days are a real thing. So take it if you need it.
Yeah, I'm going to third that PTO sentiment. And I'm like Dr. Yates, I will work and work and work, and I will when at our job we can roll over a certain amount of days. I'm rolling over the entire amount of days that I'm supposed. And I was like, that was supposed to be for you to like get away from work, and you didn't get away at all. Like, why are you rolling over this many days? Um, so I would say to know yourself in advance. So if you like music and there's a festival and the tickets are coming out, go ahead and like put some PTO days on the calendar for the days of that festival. And even if you don't go, you don't even have to buy the tickets, but you got some off days scheduled just to decompress and take some time for yourself. So those are already built in, those are already scheduled. Even if you don't go anywhere, you got some time off. And you got some time off coming. So I think in your mind, he's like, okay, I got these days coming up. I'm excited to get some time to myself. So I think that is really important. But and as far as the hobbies, I was like, at this point in my life, I have two children under the 5, so I don't really have any additional hobbies at this time. But I do encourage to have them. uh, so I do I will watch the occasional TV show. So I do like I will do things to like read, watch TV to take my mind off of things. So even take those little wins where you can. Like if you can't do much, if you don't have too much time to do any hobbies outside, even if it's just go for a walk. Just every day try to plan some time to like go for a walk and like clear your mind of things that happen from work. I think that really helps to not overload you and like pile on day after day.
Y'all, this would be my favorite question to ask other adults because I just love telling people all the hobbies that I have because I'm gonna find a hobby. I'm gonna be on somebody island. I travel quarterly. Quarterly. I'm leaving. Yeah, hopefully I can leave the country. Right now it's a little iffy, so I'm just, going state to state right now. But I'm gonna trip and travel. I do yoga, I garden, and I love like the things that are my hobbies. I also volunteer and do them, so I get to do them in community, and that's really really fun for me. So I love to garden, but I'm also a grow steward for a local pharmacy. It's like pharmacy. It's super cute, and we teach people how to grow, and I'm also learning how to grow with them, and we give them free supplies, and we be in the hood like helping people feed themselves. I love it here. I dance. I've been dancing since high school, and so when I had kids and I couldn't, and they were little Iman, and I couldn't really do nothing. I'm like, nope, I'm gonna steal away for 2 hours a time, 2 hours a week. I was doing it twice a week, 2 hours a week. I was going to dance classes and lost all that weight, and that turned into skate lessons, and I started jam skating, and yeah, like I'm cycling. I just joined a bike club. I was telling my husband, I said, "Oh, this is an expensive hobby. I need a real bike, but it's like $3,000." Yeah, and for real, like I'm gonna pick up a hobby. I'm probably gonna pick up calligraphy next. And so I do, y'all. I encourage y'all to just find something. It don't even have to be something you have to spend a lot of money on. something healing that'll get you outside, like yoga or gardening or fitness. Working out could be a hobby, but those are really good ways. Oh, and another hobby of mine is so like to Julian's point, to Dr. Jones' point, is a reset day. So I do mental wellness days. With the work that I do, it's a lot of body work, and so my chiropractor or my massage therapist, they see me 2 to 4 times a month, like 2 to 4 times a month. Like I'm pulling up on them folk. Or my chiropractor's actually mobile; he pulls up on me. But body work, yeah, mobile chiropractor, fam. I'll be anywhere in the world, and as long as it's within his radius, he brings his table to me. I love it.
Dr. Pete.
Dr. Pete, that's my dog.
Oh my God.
That's my guy. But no, definitely like just echoing the other professionals on this call, y'all, you need hobbies to reset you and to recalibrate you, but also to just like give you different energies to take back into the space that you love. What I love about, the people that I garden with is normally a lot of elders. And so they just got a lot of advice and just like love and energy that I don't normally get in the space of the work that I do because I'm normally giving it. And so it's nice to be on the receiving end of it. Okay, last couple of questions for y'all. How important do you feel like mentorship is? Do you have a mentor? How did you get said mentor? Whoever wants to answer can start that question.
I can answer that one. I think mentorship is amazing. Every stage in your life, um, you should have a mentor for where you are at that time and what you're trying to accomplish, where you're trying to go. In college, my professors were my mentors. How do I get through these classes? How do I manage my time well? How do I set myself apart as I'm applying to pharmacy schools? So I had pharmacists that I looked up to, pharmacy students who were ahead of me. I had my professors then. Right now, I have a pharmacist who's just been in the game longer than me, so she can just lead me and guide me and show me how she got to where she is. How do you handle certain things in this workspace? Um, and how did I get said mentors? Like I told y'all, be open to going to those office hours. Look, if they're open, I'm there. I was there. So just been building those relationships. And when the mentor I have now, the pharmacist that I've known for a little minute, I just told her one day, I said, you're my mentor now. She didn't have a chance to say no. I just told her. So and I said, we're going to have a lunch every month, every 2 months. I know you get busy, so we can push it to 2 months if that works for you. But let's just make sure that we we do that. And she couldn't even say no. We've been doing it for like a year now. So just being able to put your foot forward, build those relationships. So yeah.
For me, I would say mentorship is very important, but I am also flexible on what a mentor can look like. Um, because in the admin space, you can be a whole bunch of things, and but you just need somebody with experience that has walked the path, and you're able to bounce ideas out off of. So, I had several people that I could go to and ask a question, and they give me honest feedback without saying, hey, I don't feel comfortable, or we have enough rapport to be like, okay, I need to have this conversation. I'm evaluating doing this job. What do you think about it? And they were open enough to give me advice on what they thought, and I really like consider like, and I knew that they were coming from a place of love and like wanting me to succeed in whatever I was trying to do. So if it's in my career, it hasn't been formal mentorship in the sense that I meet with them, once a quarter for lunch. And I got these things. It's more of a, if I need to have a conversation about where I'm going in my career, I got a couple of people that I know are experienced to know who I am, enough about my background to help me make a choice about my future and where I want to go next.
I would say mentorship is critical. I would say, especially in the healthcare realm, because it's so much that you don't know. And I think that's the humbling part about healthcare is that like you know a lot, but then when you knowing a lot, you also realize that you don't know as much as you think you know, and nothing beats experience. So somebody is there who's been 5, 10, 15, 20 years in the game, It's so much you can learn from them. Because at least for me, I'm always a guy who says like it's always about the details. You know what I'm saying? The details is what separates you or can expand your skill set because everybody has the basics, but it's the details that separates you from the person who you compete with, and they're just from being a athlete. But I'll also say like mentors is critical because that's who you use to kind of like balance yourself. Like even I have a few mentees now, and I tell them all the time, the to me the dumbest thing you could do is the same thing somebody before you did, thinking you in the session to the room, and you're not learning from my mistakes. Because wise men learn from other people's mistakes or actions. So I take that same concept when I might call Dr. Price is another one of my mentors. I call him and ask him like, "Hey, what do you think about this? Or how do you, if you were me and you did this case, what would you do differently? Or this is what I did, and actually seeking critique from these mentors because they've been in the game. Like I was saying earlier, they've been in the game for longer than you, than you even been in the career. So a lot of these people like they have a wealth of knowledge, like kind of what Kelly was talking about earlier about when you meet older people, how they're the ones giving you the advice as opposed to you the one receiving it. It's like there's so much that you can learn and like you can expand your horizon on like your perspective on how you look at a certain situation, even if it's not like I'm using me as a example, even if it's not just dentistry, like life, business, like family, like if you have a family or something like that. There's so much you can learn from those mentors that they pretty much help you garden what it is that you're trying to like put together. So I would definitely say mentorship is critical.
And then, are any of y'all open to taking students as mentors if we had some students looking specifically?
Yes, I'm always taking mentees. Um, I mean, you can follow me on. I would definitely tell you that you could just reach out to me through. I mean, Mr. Calhoun has my contact information. I'm on Instagram or whatever. I'm always taking mentees simply because I look at it like it's paying it forward. You know what I'm saying? Like somebody had to do it for me, so it's only right that I do it for them. You know what I'm saying? And then when they get it, I'm asking the same thing. When it's your turn, make sure you pass it down to somebody who, because it's gonna come a day where somebody gonna come send you an email, knock on your office, and say, "Hey, Doctor Such and Such, I've been following your career, or I don't really know a lot about this and that. I'm interested in it." And it's just like somebody had to do it for you. It's your opportunity to pass it down for them.
I just told the students
Yes,
at
I
LSC
I
that
love
the other
taking
day.
mentees too. So I'm just like Dr. Jones. Like anytime a student needs help or anything like that, like they can always reach out to me. I say call me anytime, and if I'm not available, I'll call you back, and we'll schedule something. So yeah, I wish I had somebody my age, somebody who just came out. When I was young, trying to get into the pharmacy field. We're still close enough to the interview process that we still know what that's like. We're still close enough to what it was like to decide, okay, do I have the requirements to get into this program? Do I have the requirements to get into this program? So yes, I'm like Dr. Jones. Get my number from Dr. Mr. Jeremy, or you can also follow me on Instagram, follow me on Facebook, reach out to me there. I'm always open to it.
Yeah, same here. I am always open and available and willing to help where I can. So if anybody needs anything from me, again, Jeremy, Kayla know how to get in connection with me.
Thank y'all. So, young folk, y'all hear that? That's three healthcare professionals that are on this call that are letting you know that if you asking for help, you'll receive the help, and we know how to connect you with them at STS. All right, y'all. Our final closing question, leaving the students with some inspiration. Um, if you had 60 seconds to advise a college student who wants to enter into the healthcare field but is feeling a little bit overwhelmed. My son has to make a cameo. This is Mason, everybody. What would you tell them? So, repeating the question since I kind of broke it up, if you had 60 seconds to advise a college student who wants to enter the healthcare field but feels overwhelmed, what would you tell them?
I'll go first. So what I would advise them to do is just take a minute and come back to themselves and figure out what it is that they want to do in life. Um, because honestly, you can do almost anything in the healthcare field. So it's just a matter of them making sure that what they want out of life is in that career path, the career choice that they make. But honestly, healthcare, you can do most jobs, honestly. Even the pilot, they have helicopters in healthcare. So if you wanted to drive a helicopter, if you wanted to fly something, you could still be in healthcare and do it. So I don't think that healthcare is necessarily the thing that you need to focus on. It's more about making sure that what you're doing, what you plan to do serves you, and then find that job within the healthcare space. Because then you're fulfilling yourself as well as helping others. Because healthcare is a field about helping others. So whatever you do, you want to make sure that you're fulfilling yourself, so that when it's time for you to help others, it's not coming from a place of deficit. So I would just say, take a second, come to yourself, and figure out what it is that you want to do, and then try to make your next steps based off of that choice. So you come back to yourself first, and then move forward.
Yeah, mine would just be lots of prayer, asking God, like, what have you put in me? What did you have in mind when you created me? And He'll lead you and guide you to those things that He's already predestined for you to do. So that was one of my main things. Like, Lord, show me, if this is where you want me to be. And if it's not, don't let it work out. And He will do that. So that also just being inquisitive, like I said earlier, if you think you may want to do something, do not get into a nursing program without talking to a nurse, going to shadow a nurse, going to see if this is something that you may want to do. So be inquisitive, ask people for opportunities, even if it's non-paid. It's okay to do stuff just to learn. It's you're getting paid by learning those things. So yeah, those would be my two things. And also third is just don't let school stress you out. Find you something to do in school, hobbies wise. Of course, it's going to be stressful, but you can make that a little bit less stressful if you learn how to enjoy yourself during the process. So enjoy those times, enjoy the process, enjoy school, enjoy meeting those friends that will likely be your lifelong friends. The friends I met in pharmacy school and undergrad they're just my best friends. So yeah, that's what I would say. And also, don't give up. It's going to be hard. You're going to reach some roadblocks, jump over them, and keep moving.
I would encourage a young person that want to get into healthcare. I would say first and foremost, um, like everybody's saying, but have a talk with God. Like if ask Him to order your steps and what it is you're trying to do, and then immediately after that, I would take just a paper and a pencil, and I would immediately start making a plan for myself, just from the end goal, and then work my way backwards to where you are. So if dental school, if being a dentist is what you want to do, okay, decide what kind of dental school you want to go to. Decide when you get ready to go to undergrad, what prerequisite courses do you need. Make sure the undergrad institution has the courses that you need, and then from there, I will try to find some mentors, like we were talking about, people who've done it before. Because when you see people, like I was saying earlier in this recording, was that when you see people who look like you and they're in the space doing what you want to do, representation matters, and it makes you feel alive better about what it is that you're doing. And don't doubt yourself. Like I said, it's a part of life. Like things happen. You might be in a situation where like you might have a setback or whatever, but what the kids saying now, the two steps was part of the journey too. You got to take a two-step back before you can jump forward. It's a part of it. Life is all about is really 10% about what happens to you, but 90% about how you react to it. you know because if you really want it, it's just you can't it is always about perspective. Like you can't always look at something like it's a bad thing. Sometimes this opportunity is just dressed in a way to where you're supposed to go through it in order to gain the tools that you need in order to get where it is you're trying to go. Because I get this analogy with my mentees all the time. It's like I can't give you $10 million if you don't know how to manage $100,000 or $10,000. It's baby steps to it. you know So always be encouraged, understand, that you gotta like listen to yourself and just be able to keep God first and all everything you do, and then He'll guide you where you need to go.
I appreciate y'all. I tell Jeremy every time I lead these, I know y'all be here for the students, but I be picking up some stuff too. So thank y'all for being so encouraging. Thank you for your time, your collaboration, and your willingness to, make sure that we're leaving this generation of students better than we found them and pouring into them. Like, some leaders and professionals that we've looked up to have poured into us. Again, if you're rewatching this, please check out the other videos in this series. We are coming back several times a month with a different So You Think You Want to Be series. And this one was definitely impactful for me personally as a healthcare provider. And again, just thanking y'all from the STS team. We will drop their contact information in the description as well.